Bismillahirrahmanirrahim. Quote for today is whoever is kind, Allah will be kind to him. Therefore, be kind to man on earth. He who is in heaven will show mercy on you. Today, the topic of my presentation is COVID 19, and I'll be presenting it under the supervision of my professor, Dr. Saira Afsal. Learning outlines of the presentation are introduction of COVID 19, epidemiological determinants, chain of transmission, clinical presentation, levels of prevention, and recent advances, along with MCQs at the end. By the end of this presentation, participants will be able to describe about the epidemiological determinants and prevention aspects of COVID 19, management aspects, and knowledge of recent advances. Introduction is that coronavirus are a large family of viruses which may cause illness that are known to cause respiratory infections, ranging from the common cold to more severe diseases, such as Middle East respiratory syndrome, severe acute respiratory syndrome, and coronavirus disease, the most recently discovered coronavirus. It is an infectious disease that is caused by the most recently discovered coronavirus. This new virus and disease were unknown before the outbreak in Wuhan, China in December 2019. COVID-19 is now pandemic and is affecting many countries globally. This shows epidemiological determinants that health and healthcare delivery, social and community contact, neighborhood and built-in environment, education, economic stability, social determinants of health and healthcare delivery along with economic stability. All these factors are interrelated that are causing the disease to spread. Agent factors are SARS-CoV belongs to the broad family of coronaviruses. It is a positive single-stranded DNA RNA virus with a single linear RNA segment. Host factors are maybe origin a bat. Intermediate host for MERS-CoV can be camel. For SARS-CoV, it's cat. And for SARS-CoV, mode of transmission is a close contact with mucus or fluid. Final host is human, and diet or close contact, airborne infection. All these are the host factors. Environmental factors are the role of environmental factors and conditions such as temperature, humidity, wind, speed, as well as food, water, sewage, air, insects, inanimate surfaces, and hands in the COVID-19 transmission. Source of infection are nasopharyngeal secretions, contaminated fomites, and infected dust. Mode of transmission for COVID-19 can be in two ways, direct and indirect. Indirect, it is droplet infection, and for indirect, it is fomite borne, and incubation period is 2 to 14 days for indirect transmission. Complications of COVID-19 may include pneumonia, acute respiratory syndrome, multi-organ failure, septic shock, and it can also lead to death. In pregnant females, COVID-19 infections can cause stillbirth and abortions. COVID-19 variants, multiple variants are found for COVID-19. However, this shows alpha variant, beta variant, gamma variant, delta variant, opposition variant, zeta, eta, theta, and iota, kappa. All these are the variants that has been identified by WHO. However, 5 basic variants of concern and 8 variants of interest. These are named after the letters of the Greek alphabets. The ones that are highlighted in the yellow color are the variants of concern. COVID-19 is the WHO considers Omicron's global risk to be very high. Omicron is a highly divergent variant with a high number of mutations. Symptoms of COVID-19 are data shows that the disease is mild in 80% of the patients, severe in 13%, and critical in 6% of the patients. Most common symptoms are fever, fatigue, dry cough, aches, body pains, runny nose, sore throat, and shortness of breath are the symptoms. However, difficulty breathing, chills, muscle pain, headache, sore throat, new loss of taste or smell, congestion or runny nose, nausea, vomiting, diarrhea. These are all the symptoms of COVID-19. According to WHO, COVID-19, a case definition is a person who meets the clinical and epidemiological criteria. Clinical criteria is acute onset of fever and cough, or acute onset of any three or more of the following signs or symptoms. That is fever, cough, and general weakness, fatigue, headache, myalgia, sore throat, coryza, dyspnea, anorexia, nausea, vomiting, diarrhea, and altered mental status. An epidemiological criteria is residing or working in an area with high risk of transmission of virus, closed residential settings, humanitarian settings such as camps and camp-like settings for displaced persons, anytime within the 14 days prior to symptoms onset, or residing or travel to an area with community transmission anytime within the 14 days prior to symptoms, or working in any healthcare settings, including within health facilities or within the community anytime within the 14 days prior to symptoms or onset. A patient with severe acute respiratory illness is said to be a patient with history of fever that is measured above 38 degrees centigrade, having a severe cough with onset of less than 10 days, and that person requires hospitalization. Probable case of SARS-CoV infection is a patient who meets clinical criteria and is a contact of probable or confirmed case, or linked to a COVID-19 cluster. A suspect case with chest imaging shows findings that are suggestive of COVID-19 disease. A person with recent onset of anosmia, that is loss of smell or loss of taste, is in the absence of other identified causes, and death not otherwise explained in an adult with respiratory distress preceding death, and there was a contact or probable or confirmed case that was linked to COVID-19 cluster. Confirmed cases of SARS-CoV-19 infection is a person with a positive nucleic acid amplification test, a person with positive SARS-CoV antigen RDT test and meeting either the probable case definition or suspect criteria A or B. An asymptomatic person with a positive SARS-CoV antigen RDT who is a contact of probable and confirmed case. Levels of prevention. Basically, first level of prevention is primary prevention. That first is health promotion and then specific protection. This slide shows some COVID-19 variants that may spread rapidly. Luckily, some basic protective measures work against all COVID-19 variants. And the other slide shows some of the variants of the coronavirus, such as Delta and Omicron, are spreading more easily between people. And we know that we can protect from the virus, and now it's a newly variant available. Use and care of the mask, it comes under the primary care. Note that the COVID-19 community level where you live. COVID-19 community level are a tool to help communities decide whether preventive steps to take based on the latest data. Below is wear a mask based on your personal preferences and informed by your personal level of risk. However, medium level is if you are immunocompromised or high risk for severe illness, talk to the healthcare provider about an additional precaution, such as wearing mask or respiration indoors in the public. If you live with or have a social contact with someone at high risk for severe illness, consider testing yourself for infection before you get together and wearing a mask when indoors between them. High risk is wearing a well-fitting mask indoors in public, regardless of the vaccinating status or individual risk. And if you're immunocompromised or at high risk for severe illness, wear a mask or respirator that provides you with the greatest protection. There are a few guidelines for vaccinated people too. The CDC has updated its recommendation on consuming some activities once you have completed your COVID-19 vaccine and allows at least 2 weeks for your immune system to respond after the last shot. Fully vaccinated people, the CDC continue to recommend that the mask and physical distancing are required when going to the doctor's office, hospital for long hospital care, including all Johns Hopkins hospitals, care centers, and offices. Specific protection is a primary prevention of disease by ensuring high population immunity through immunization. COVID, these are all the COVID-19 vaccines that has been given to patients. Sinovac, Moderna, Johnson and Johnson, Sinopharm, AstraZeneca, Pfizer, Biotech, Sputnik, and Novavax. All these are the vaccines that have different effects on the people, and the percentages are shown along with the slides. However, the best is shown by the Moderna, and after that is AstraZeneca. COVID-19 vaccine during pregnancy. Maternal COVID-19 vaccination in early pregnancy is not associated with fetal abnormalities. However, the COVID-19 vaccination schedule can be started anytime during pregnancy. And in case a woman has been infected during the current pregnancy, then she should be vaccinated soon after the delivery. Secondary prevention of the spread by the rapid investigation of close contact to ensure the proper treatment. This shows that COVID-19 case management and comprehensive review. Diagnosis is by the real-time PCR and rapid testing kits or antigen-based test. Diagnosis is done by the laboratory that leads to prevention. And imaging is done for prevention. Therapy is done. Life support is given. There are no specific treatments. However, antiviral treatments are given. Well, in case of supportive care, ventilatory support is there if the disease happen. Otherwise, isolation of the patient is the treatment. Drugs that are given in order of preferences. Ritonavir boosted virus, that is Paxlovid, remdesivir, alternative therapies for use only when neither of the preferred therapies are available, feasible to use, or clinically appropriate. Bebtelovimab or molnupiravir for use only in regions where the Omicron subvariant is not the dominant subvariant and in situations where none of the preferred or alternative options are available, feasible to use, or clinically appropriate. Tertiary prevention of the complication and deaths by early diagnosis and prevention. This is given in the tertiary care setting. It includes ventilator care or the care that is provided by the antiviral medications injected. Endemic COVID, the end of pandemic. Coronavirus, what does the epidemic mean, and are we there yet? We're all in a rush to get the endemic stage. There are few potential roadblocks in the way, namely variants. The problems hanging all over us. What happens if a new variant should occur? In other variants, we are far from being able to predict what will happen out with the COVID-19. Once they've decided at a special meeting, some countries still could be stuck in the epidemic status, while others may stick right into the endemic. And our experts noted an endemic disease does not change the fact that people still need to protect themselves by getting vaccinated. The virus might find you if you are unvaccinated or you have underlying risk factors, and a small number of people who still needs to be hospitalized. Will COVID-19 become endemic, and what does that mean? COVID-19 endemic may translate to continuous in places like public transportations, indoor settings, and offices. This may be especially important during winter time peaks and when respiratory viruses are easier to transmit. But with the good community efforts, high vaccination rates, and improved treatments, COVID-19 can potentially become a predictable disease that communities can cope with much as they do with the seasonal flu. Uh, is this what an endemic disease looks like? There's been a political reframing of the ideas of endemic as something that is harmless or normal. However, but epidemiologists use endemic to mean something we should watch carefully, he said, because an endemic disease can become epidemic again. This shows how medicine must change for endemic COVID-19. plausible end game, but if long-term circulation is unavoidable, it isn't going role for public health interventions. Annual COVID-19 booster shots must be provided, and the whole population care is a must taken step to avoid this thing to happen. Lessons for learning: our acknowledgement of the endemic feature of SARS-CoV shouldn't lead us to turn back our backs to the medically vulnerable and embrace a return to normal. Instead, we must collectively insist on effective, ongoing, and sustainable policy response. Now, coming towards the recent advances, this shows then public health consideration of population immunity and endemicity. Key points are researching a critical population immunity threshold to eliminate ongoing SARS-CoV transmission is not likely to achievable due to variety of factors including waning immunity and the emergence of new variants that escape immunity from prior infection and vaccination. As such, population immunity should be thought of as being as the continuum. There is currently a lack of defining correlates of the profession, that is SARS-CoV immunological markers, which limits the ability to determine the extent of population immunity. Vaccinations are likely to continue to play an ongoing role in sustaining a level of immunity in the population that is required to maintain endemic equilibrium. In Pakistan, from January 2020 to April 2022, there has been approximately 1,52,666 confirmed cases of COVID, with 30,000 deaths that are reported to WHO as of 16 March, and a total of 2,26,000 vaccine doses has been administered. Pakistan reports zero COVID deaths for the first time in 2 years. COVID-19 results briefing. In Pakistan, that was published in March 19, 2022, our model suggests that behavioral modification, particularly declines in mask use and social distancing, may be the most important explanation for increasing case numbers and in some countries in Europe. Our model do not suggest that there will be much increase in the next week, if at all. However, if it is certainly possible that to a rapid return to pre-COVID behavior, low vaccination rates, waning immunity, and the spread of COVID virus can be seen as a short period of increasing case number in Pakistan. Now coming towards the MCQ session. First MCQ is COVID-19 is now a pandemic and is affecting many countries globally. What are the precautions that needs to be taken to protect from the coronavirus? Option A is cover your nose and mouth while sneezing. Option B, more garlic into diet. Option C, visit a doctor for antibiotic treatment. And option D, wash your hands after every hour.
A.
Yes, option A is the right one. Second MCQ is the effectiveness of COVID-19 vaccine from each manufacturer must not be compared because option A, the companies are not interrelated. Option B, each vaccine trial was done on different population with different setting. C is the animal trials were done first, and option D, availability of vaccine at different sites. Option B is the right one because B is the right one because vaccine trial was done on different populations with different settings. Third MCQ is when should the COVID-19 vaccine be given to pregnant women who has been infected during current COVID-19 pregnancy? Option A is COVID-19 vaccine should not be given to pregnant women. B is the during pregnancy COVID-19 vaccine can be started anytime. C that she should be vaccinated soon after delivery. And D, women should get 2 doses, first during pregnancy and D right after pregnancy.
C.
Yes, C is the right one. She should be vaccinated soon after delivery. Fourth MCQ is according to new CDC guidelines, which of the following statement is correct for a person who has been fully vaccinated while going to public places? Option A, can resume activities without wearing mask or physically distancing. B is mask and physically social distancing are required when going to public places. Uh, C is antibodies present in the blood provides enough protection. And D is the latest variant is so weak that wearing mask is not necessary for vaccinated person.
B.
Yes, B is the right one. Mask and physical distancing are required when going to public places, even after vaccination. Fifth MCQ is social distancing puts space between people. By keeping the distance from others, people infected with the virus are less likely to spread it. When it is safe to be closer than 6 feet to another person who is not sick with COVID 19. A is when a person is related to you. B when a person has already has COVID 19. C when a person normally lives with you. And D when you are in an outdoor patient department. C when a person normally lives with you. Sixth MCQ is a 33 years old white female presents after admission to the General Medical Surgical Hospital ward with the chief complaint of the shortness of breath with high grade fever. She has been admitted with the suspicion of COVID 19 infection. The drug of choice for this patient should be option A remdesivir, option B acyclovir, option C is famciclovir, option D valacyclovir, and option E is brufen.
A. A.
Yes, option A is the right one. Remdesivir is the drug of choice for such patients. Seventh MCQ is complications of pregnancy are health problems that occur during pregnancy. They can involve the mother's health, baby's health, or both pregnant women with COVID 19 at the risk of increased infection. Which of the following complications? Option A gestational diabetes, option B cesarean before delivery, option C placental abruption, option D obstetric cholestasis, and option E preeclampsia.
E.
Placental abruption is the most common cause that is caused by COVID 19. Eighth MCQ is nowadays many countries are on the track to becoming COVID 19 endemic countries, but epidemiologists use endemics to mean something we should watch carefully because option A new drugs are introduced for the treatment, B is all endemic diseases can become epidemic again, C is children are more affected by virus, and D most of the people are vaccinated.
B.
Yes, B is the right answer. An endemic disease can become an epidemic again. Ninth MCQ is globally about 3.4% of the reported cases have died. Which of the following group has the highest risk of mortality in COVID 19 infection? Option A pregnant women, option B kids 5 to 10 years of age, C men 30 to 50 years of age, and D is the older population.
D.
Older population is the right one. 10th MCQ is in most part of the world, COVID 19 cases has shown a declining trend and are moving towards the endemic state. But recently, which of the following may be the most important explanation for the increasing case numbers in some countries in Europe? Option A declining in mask use and waning immunity. Option B more reporting of the cases among younger population. Option C stronger virus variant. And option D opening of the schools and educational institutions.
A.
Yes, this is the most common cause. A is the right answer. This is the key. These are my references. This is the YouTube link, and thank you.